Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hello, Nita Valens. Hello, I do not hear you. Alex, can you patch us through together? Well, I guess I will just take this from the top. This is Dr. Marc Darrow. I do regenerative medicine, and I wonder if anybody can hear me out there. Alex, can you hear me? Hello? Okay. Is Nita there? Okay. So in the meantime, before Nita gets here, Dr. Marc Darrow, I am a physiatrist. That's a guy who, in this case, does orthopedics, but not surgery. And the plan is to save you from having a needless surgery. We don't want people who don't need surgery to get surgery because there's no reason, right? And having surgery has some, unfortunately, some bad outcomes. And I'd say probably half of my patients that come in, new patients come in, have had what's called a failed surgery in orthopedics. That could mean that they did a meniscal tear surgery, a labral tear surgery, which could be hip or shoulder, a rotator cuff surgery, something of that nature that they never really needed to begin with. And in my humble opinion, as a doctor, been doing this work, I started med school in 1990, so that's a long time ago. My experience is that probably half of the orthopedic surgeries that are done that shouldn't be done fail. When I say shouldn't be done, there are other techniques we have now called PRP, platelet-rich plasma, and stem cell therapy, and we can take these cells from your own body and then inject them where the problem is. And the reason I got into this kind of medicine was because I had a lot of sports injuries myself. I am here, Anita. Darrow? Alex, you're not patching us together.
Can you hear me, Dr. Darrow?
Oh, yes, and I am
Yay!
Okay, are you with me now?
Yeah, totally.
Okay. So you can sit tight, Nita, for a while, because I'm in the middle of introduction here.
Okay, go for it.
And then if you need to pop in to help me out, you're welcome to.
All right.
So the reason that I do this work is because I had so many sports injuries. I was that kid that was getting injured all the time, and I like high-speed sports, and I like repetitive sports. And I've had what I'll call near-death injuries or experiences from sports, like the time I had, I was out surfing on the north shore of Oahu with perfect 6-foot waves, and it was the classic day, and I started paddling out. Before I knew it, I was about a mile offshore. I got stuck in a riptide, and I didn't know what I was going to do. I turned the board sideways. I had read in surf magazines that that'll help you get out of the rip. It didn't help at all, and I was moving very, very fast. And then out of nowhere came what's called an outside set, and I was about, it's hard to say, mile offshore by then, and a giant wave came. And it's not the kind of wave I could ever take, but I had no choice. So I turned my board around and started paddling. I went right down the face of the wave, and I thought I was going to die, literally, because I couldn't breathe. I was just tumbling. I didn't know which way was up or down. You surfers know what I am talking about. It's a very, very humbling experience. And just when I thought I was going to have to take water in, I popped up to the top, and I was able to paddle. And then there were 5 more of those outside waves on the set that kept taking me down. The first one was the worst. And then it kept pushing me closer to shore. And when it was over, I paddled in, and my girlfriend, who was sitting on the beach, who saw me like a drowned rat, started laughing and said, "I told you couldn't handle that." And I've had many other experiences like that in sports where I took on a little bit more than I should have. But I got into this specifically, doing PRP and stem cells, because initially a wrist injury had taken me out of sports, and that was from repetitive golf way back when. And the worst part was I was starting to get sore, but then I hit the ground with my club and hyper-reflexed, or hyperextended, I should say, my wrist, and I couldn't do anything for a while. And then I hurt my shoulder weightlifting with a wide bench press, and I didn't have, but there was a doctor that came to UCLA where I was in my residency, and he said that he healed about 80 to 90% of his patients using proliferative therapy, which is kind of the forerunner of the newer regenerative medicine today using PRP and stem cells. And I went to his office and to learn what he was doing, and he eventually took me to a national convention in Las Vegas on the subject of prolotherapy, and there was a course there, a class on wrist injections, so I jumped in on that, and I never thought I would have my wrist injected, but I was just curious. And then one of the doctors there said, "It seems like you're playing with your right wrist. Is it painful?" And I said, "Yeah." And he said, "Well, let me inject it for you." And I said, "Seriously, you want to put a needle in my wrist?" And he said, "Yeah." He said, "You'll be stiff for about a day, and then it's going to be healed." And at that point, I was like, well, I don't want a needle in my wrist, but I need to heal. So I succumbed to prolotherapy and getting an injection. This was back in the days when we used sugar water, believe it or not, concentrated dextrose mixed with lidocaine, local anesthetic.
I recall that.
Back in the day, because you had it done on your neck. And so I had that done, and my wrist got stiff. It felt almost like right after the injury. I was a little bit nervous about that. And by about 24 hours later, which is what he had told me, the wrist felt about 50% better than it was when it was injured. And I was like, this can't be, this is impossible. So I got back home and I injected my own wrist. I did it myself. And I had to do that about 3 or 4 times. And lo and behold, the wrist has been amazing. I had a few more injuries to that wrist. And by the way, know that doing regenerative medicine is not the end-all of healing, because you can re-injure something. I'm very active. But at any rate, I can't remember the last time I had to inject my wrist. I have no wrist pain. I will go play golf later today, and I can do all the sports I want. My wrist does not bother me. And I then thought, well, I'll try my shoulder, because I'd injured my shoulders. I'd gone to a trainer who had me doing wide bench presses, and that actually it stretched out my right shoulder. I guess it stretched out both. My right shoulder was impacted, and I didn't know what to do, so I was in Hawaii at the time, and in medical school, and I was doing a rotation with an orthopedic surgeon, very nice guy, and he said, well, let me inject it with steroid. And I was like, what's that? He said, well, just watch. And he pulled out a syringe and got some, I think it was dexamethasone mixed with some lidocaine. And my shoulder, in about 1 minute, felt great. And I thought, this is amazing. This is great. Steroids are great. Well, in about a month or so, the pain came back even worse. So what did I do? I went back to him and I said, it came back. He said, well, let me give you another steroid shot, cortisone. I was like, okay, because I didn't know anything then. And it felt great for another month or so, and then it came back even worse. Now I know, and you can look on Google, put in the words cortisone and cartilage, you'll never get another steroid shot, because what it does is it actually deteriorates the tissue. So it can feel great for a while. They don't usually last. And then you're in worse trouble than you were before. So a lot of the arthritis that we see in knees and shoulders, I want to get a drink of water here for a second.
I'll give the phone number while you drink water.
I will.
I'll
give out.
Call.
I will. It's a great idea, Anita. Thank you. I forgot.
You're welcome. 866-870-5752. That's 866-870-5752 right here in the studio.
And if you call us right now, I will send you out a copy of my book, Stem Cell and Platelet Therapy. Regenerate, don't operate is the byline. And the foreword is written by Suzanne Summers. May she rest in peace. And it's an amazing book. You know, the whole idea is regenerate the tissue around your injury. Don't put a knife in to cut tissue out. Unless it's, you know, something you really need surgery for, then go for it. But most of the surgeries that are done today in orthopedics, in my humble opinion, shouldn't be done. I see way too many people getting rotator cuff surgeries, meniscal tear surgeries for the knees, and surgeries for arthritis, replacing joints anywhere from the finger joints to the shoulders, the hips, the knees, ankles, that never needed to be done. And unfortunately, many of them don't work out very well. And if you have a problem with that after one of those surgeries, that's typically a big problem. And if you put a prosthetic in, there's not a whole lot that you can do with regenerative medicine in most cases, because it's no longer biological tissue you can regrow. It's plastic and metal. You can't regrow plastic and metal. And I've seen some disastrous joint replacements. I see them all the time, and I'm not putting down the surgeons. I think they're amazing people. I think it's a very high level of commitment to be a surgeon. You know, you see a lot of terrible things happen. I did a lot of surgery in my training during medical school. I called up all the surgeons in town, and even in pre-med I did. And I said, I want to come into surgery, and I want to learn more about it because I'm going to be a surgeon. And then when I had my shoulder surgery, that was it. It literally destroyed my shoulder. And for about 4 years, I was miserable. And then I injected myself, and that was back in, my gosh, when was it? Trying to think. It was a long time ago. 1998, I think it was. 97, 98. I injected my shoulder that had about 4 years of misery after the surgery failed, and it healed absolutely 100% overnight. I was able to move it pain-free all the way and do sports and all that good stuff. But don't think this is a miracle treatment. It is not. Injecting yourself, or I should say I inject myself, but you won't be doing that. But having it injected by me or another guy who does this work may take a few treatments. It's not some magical cure. It's certainly a lot better to me, in my mind, than getting a surgery that can have disastrous side effects, infections. A lot of times people have a joint replacement, let's say hip replacement, and then one leg is shorter than the other, and then they end up with back pain. And they end up with hip pain, back pain, knee pain, ankle pain. So be careful. If you're going to get a surgery and you're determined, make sure you get a few second, third opinions from other doctors to see if you really need it. But please don't go to the same type of doctor. Go to a regenerative medicine doctor instead of an orthopedic surgeon. Typically, surgeons have the same culture and the same beliefs. If I think you need a surgery, I will send you to a surgeon. I know the best surgeons in town. Okay? Usually I don't have to, but I mean, it can be. So I'm going to give out a couple of phone numbers. Get your pencil. The number to call us right now at the studio is 866-870-5752. I would love to talk to you. If you're shy, use a fake name or pretend it's your family, friends, or somebody else you're talking about. But we get a lot of great callers. And then if you want to get a free consult over the phone with my staff, you can call there right now. And the phone number there is 800-300-9300 to the office. I'll repeat that. That's 800 800-300-9300. And then if you want to look at me and Dr. Grove doing injections, Dr. Grove is the new kid on the block who works with me, and he is an amazing, amazing doctor. He's a genius, literally, knows everything about everything. I thought I knew a lot, but he knows a lot more than I do. And his injection skills are par excellence. He's been doing this kind of work for the past 10 or 12 years, and just an amazing guy. He played linebacker for the Cornhuskers in Nebraska. He was the captain of the team. He's a big guy, great personality. All the patients love him. And since he's been injecting, no one asks me to inject anymore. They all love him.
Oh, that's funny.
It is. Anyway, the website is www.jointrehab.com, and you can see videos of us injecting. You can read about all the science in, the regenerative medicine world about stem cells and platelets. And if you call in now, I will mail you out for free. I'll pay the postage, and you'll get a copy of my book. It's about 200 pages and about 250 scientific studies about stem cells and platelets, and why you should no longer get orthopedic surgery unless it's really necessary. You know, if you're in danger, you've broken a bone or something like that, and it's sticking out of the skin, yeah, you need surgery. But typically for arthritis and meniscal tears and the knee rotator cuff tears, labral tears in the shoulder, the hip, surgery to me, and I say it always, in my humble opinion, you don't have to believe me, is definitely not the answer. I had that surgery on my shoulder, and I am so sorry I did. It took me a few years, and it never got better. And then self-injection back in the day with a proliferating agent healed it up overnight. So I believe in this stuff. People go, wow, you're really an advocate. And I go, I'm not really an advocate as much as I've had it done to me, and I've done it to myself. I've done both my knees, both my shoulders, my right wrist I've done, my elbows I've done, and I've injured my neck and back, and I've had, usually at a national meeting when they ask for people who want to get injected to show everybody else how to do it, I'm the guy who raises my hand right up, and they go, what body part do you want us to inject? And I go, what body part do I not want you to inject? I mean, I am 75 years old, and I still work out hard. I'm very gifted in terms of my youthfulness, and most people say I look about 20 years younger than I am. I don't know if that's true or not, but I keep working out. I work out every day of my life, and I do weights, and I run up in the mountains where I live with my husky Bella. She's a fast one. And Dakota went up to the Happy Puppy hunting ground a few months ago, so he's not with us anymore. But I used to put their collars together and put a leash in them, and they'd run me up and down the mountain. They'd pull me up and down the mountains. Bella's not a puller, but she's a dainty little girl, and she can almost keep up with me. I have to drag her a little bit sometimes. So, yeah, I like to sprint. Whatever I do, I like to do intensely in sports. I'm very repetitive. There are times I'll hop in the sand trap at my golf course, and I'll spend an hour or two hitting one shot just to perfect it. And repetition causes injuries. It does. And I know about that, and I'm a dumb guy. I'm real dumb when it comes to not taking care of the body the way I could. But at the same time, I know that I can heal myself, so I don't really worry about it. So, Nita, I'm going to give out the phone number again. If you want to call us live right now and ask questions, we've got a few minutes before the break. And the phone number here to the studio is 866-870-5752. And if you'd like to call the office and get a free consult by my staff over the phone number to the office is 800-300-9300. If you want to watch me doing these procedures, there's videos of me and Dr. Grove, my new injector, And the website number to put into your browser is www.jointrehab.com. There's a spot on every single page to email me. If you want to email me with any personal questions, I will answer them. And I get a lot of people that ask me about cardiac ablation because I had one done. And I'm willing to talk about anything in medicine. If I don't know about it, I'll look it up and I will get back to you. Most of my questions on the internet, on the website, are about orthopedic medicine, why people email in and say, I don't want a surgery, what should I do? Or I've had a surgery and it failed, or I've had a surgery, it failed, and I don't want another one. So all these kind of questions I'm very, very happy to talk about. Neck pain, back pain, arthritis, shoulders, hips, elbows, muscle tears, ligament tears, you name it. That's my line of work. So the first question I'm going to go to here is called patellar tendinitis. What does that mean? And by the way, you can go to Google and just put in those terms, patellar tendinitis. It'll come up. And on the left side of the screen, on the upper left corner, you'll see a menu button that says images. Just click on that and you'll see pictures of these things or drawings, and you'll know what you're dealing with. If you have something that a doctor tells you have and you want to know what it looks like anatomically, look it up on Google and click images. So this one says, my 17-year-old son has been diagnosed with patellar tendinitis. It's been going on for almost a year and is only getting worse. He is in the beginning of his junior year basketball season. He is barely able to do anything. He has tried physical therapy, dry needling. That's when you take a needle and you just poke it many, many, many times to create some trauma and bleeding. And has seen an orthopod, that's an orthopedic surgeon, who basically said there's nothing he can do. Now, I love that. When a surgeon said there's nothing he can do, I love it because that means there's something I can do. Because they do what they do, and I do something a little different, which is to heal the area without surgery. This person questioning says, we're desperate for help. I brought up PRP with the surgeon, and he said he would not recommend it. Of course he wouldn't recommend it because he doesn't do it. When doctors are not up on something, they are down on it. As far as I'm concerned, the first thing an orthopedic surgeon should learn is regenerative medicine because it's conservative. You don't hurt people with it. Way too many people get hurt with surgery. I am sorry. I love surgeons, and I think they ought to stick to the stuff that they should be doing, not the stuff that can be healed without putting a knife in the body. I look forward to hearing you. Thank you so much, Dr. Darrow. I love listening to your radio show, and I would appreciate your response. So I did respond to this person, and they are actually coming into the office next week. And I have very high hopes. We deal with patellar tendinitis all the time. What is it? It's typically from jumping. So he is a basketball player. He's 17 years old, is he? Yeah, 17 years old in his junior year. And so what happens is every time you jump and land, the quad muscles pull. They contract. They pull on the patella, where the quad tendon inserts on, and then that will actually pull. The patella will pull on the tibial tuberosity, and in between those two things is the patellar tendon. Okay? So it gets stretched out. Really, it's just a stretch injury. And then the enthesis, which is the spot where that tendon inserts on the patella, is irritable. It's not a big deal. It's so easy to fix. We do them all the time. Dr. Grove and I do those all the time. I should say Dr. Grove is doing them now. I've retired from injections, and I'm still managing the clinic, marketing, and monitoring and helping take care of the patients. But Dr. Grove's got great injection hands, and he's got great skills with the ultrasound, which is something so important. Stick with us, and I'll get into more of this, and I hope you give me a call now after the break at 866-870-5752. Nita Valens and I want to hear from you.
Absolutely. And we'll be right back after this.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300.